Welcome, and thank you for tuning in for our second episode of Spotlight on Community Giving. In this show, we will feature the nonprofits who are doing transformative work in our community, as well as the donors whose philanthropic gifts make this work happen. So today, we're really honored to be joined by two incredible professionals here in the Merrimack Valley area. Dr. Kumble Rajesh, who's the Chief Medical Officer, or CMO, at Lowell Community Health Center, and Sachenda Uch, who runs the teen programs and has a leadership role there at the Lowell Community Health Center. So, Sachenda, Dr. Rajesh, thank you so much for joining us today.
Thank you for having us.
Yeah, thank you.
My name is Elsie Nunn, and I'm the Director of Development at the Greater Lowell Community Foundation. So I would like to say, first of all, you do some incredible programs over at Lowell Community Health Center, and it's a really unique model. So Dr. Rajesh, can you tell us a little bit more about the health center, where you're located, who are the people that you serve, and how people go about experiencing your services?
Oh, sure. Lowell Community Health Center is a federally funded community health center that's located within the city of Lowell here. And we have multiple sites currently, about 8 sites or so, including school health and behavioral health services, as well as a shelter that we actually have a provider going in and seeing clients there as well. We cater mainly to the underserved population, uninsured, underinsured population, but we accept all payers at the health center as well. We represent, health centers are a unique healthcare system in that we come as close to the multifaceted health care that we can provide, including just not the primary care alone, but supportive services such as social work services, behavioral health services, nutrition services, counseling services for financial well-being of the patient. So these are things that we capture along with just the primary care services. We have specialties such as pediatrics, internal medicine, we have OBGYN, family medicine, psychiatrists on board as well with nurse practitioners and MD level providers. So we provide multi-specialty care. And we hope to, again, improve on that. We provide care for almost 1 in 3 Lowell residents right now.
Wow.
We totaled about 41,000 visits in 2011 alone. And we hope to increase that by 8 to 10% every year for the next 3 years. So caring for about 1 in 2 of Lowell residents.
Amazing. And how do people hear about your services?
Primarily word of mouth
Yes.
here in Lowell, but we have a community outreach program that goes into communities and talks about the health center and the benefits. We do public screenings for health problems such as renal disease, hypertension, diabetes. We have group therapy sessions. We also have HIV services and addiction treatment services. So it's really a widespread reach that we have with the community, and we have a really strong understanding of what the community needs are. And so we have the community outreach workers help spread the word. And obviously through the main hospitals here, Lowell General Hospital, we get a lot of referrals through there as well.
Sure. And how does it work, if somebody's interested in care, or they're interested in finding more about how you work,
Sure.
or they are looking for a doctor and
Sure.
they may not know how to access your services, what do you recommend? If one of our viewers says, I want to check out the health center, or I've been
Sure.
meaning to make that annual appointment, so what do you recommend?
So, they would have to pick up the phone and call us.
Sure, okay.
And they have to connect with us, and they can do that. Once they do that, pretty much everything from there is automatic. If they need counseling to help set up their insurance plans, we can do that. We have health benefits program personnel that can actually guide people through the various benefits they can get through various insurance programs. So it's a very, very strong program there that'll help set up some sort of a safety net for the patients in terms of insurance. And from there, they go on to seeing an available provider. If they need a pediatric appointment, if they need a family of with adults and children, they can set up appointments with the same department with the same provider, or they can go be seen by an internal medicine provider or a pediatric provider as well. So once they're into the system, they get channeled into different providers at sites right now, which hopefully we can avoid with our new up-and-coming building.
Wonderful. Well, Lowell Community Health Center has been in the news a lot lately. You're doing some really innovative things in a number of ways, and you have some inspirational leadership. Dorcas Griggs-Sato.
When we started our campaign, we really had no donor base.
And so engaging donors has been an interesting process for us. We haven't necessarily followed what is usually done in capital campaigns just because we didn't have a donor base to fall back on. And we have used many strategies for reaching out to people. Our first effort was really to make the health center more visible in the community. Many people did not know about the health center, didn't know what we did and what we meant to the community. So with the help of local media, we have been getting the word out about the community. We go to any events and meetings like the Rotary to talk about the health center and about our building project and capital campaign. And we have used social media. So we have a very creative designer on staff who has helped us with email blast as we have built our email list and our donor list. And one of the key things in our reaching out to people has been our hard hat tours. And these really give people a chance to get almost as excited as we are about the project and to go into the mill building, see what our plans are, sort of see what our vision for the future of the project is.
Through the Greater Lowell Community Foundation's Women Working Wonders Fund, I actually went on a hard hat tour. And it was there that it resonated with me that I have history with the Lowell Community Health Center. I was one of their first patients back in the early 70s, and quite a compelling story that they both helped me and my brother through some difficult medical procedures. So I felt that I needed to give back on a personal level. For this particular campaign, the Lowell Community Health Center, as I mentioned earlier, I was one of their first patients. Our story actually was we went to the North Common for our health care, and my brother was diagnosed with cancer. He didn't survive, but had he not received that care at the Lowell Community Health Center, who knows how much longer we would have him. I'm pleased to say that in addition to being a donor, I've raised over $10,000 to name a pediatric unit in his memory.
So Chenda, tell us a little bit about the teen programs over at Lowell Community Health Center. I mean, first of all, it seems like an innovative thing for a health center to have an entire teen program suite. So I'm curious to know, how did that come about, and what role do you get to play?
Definitely, it's like a great opportunity to be under the health center and to be getting the support of the health center through that aspect, at least, because teens, they do need health. They do need a place where they can find support and things like that. So part of it was we were founded in 1988. The Teen Coalition, it was called then. Because it was we started out as a community-based coalition, which our focus was more about on teen pregnancy and violence prevention, because during that time there was a high teen birth rate, and also violence in the community amongst gangs were heavily high. And throughout the years, as we grew with staff, we also added along HIV and AIDS awareness and substance use and abuse prevention. So now we have all these 4 topics that we really focus on to get and educate young people so that they can understand some of the risky behaviors that we want to set aside from what they're already doing. So a lot of the programs that we offer are very fun and innovating and very engaging. We do it in a way where we're not just talking to them or educating them or telling them that, hey, it's not okay to do drugs. We actually let them do the work. We let them find out what the issues, the core values and core issues are in the community, and they bring it back to us. And so a lot of this is like really trying to create, we're trying to build leadership and opportunities for them so that they can come back and give it to the community in that way. And a clear example is like one of our biggest events that are happening this summer, Dance for Peace. This is a youth-led event. We have about 70 young people who come and volunteer just to be a part of this event, and this is more of a violence prevention event. They choose their own topics, they create their own slogans, and they even figure out who is actually going to be in the act and who will be performing and how they're going to create a skit so that the community can understand what is happening. And for this year, they decided to tackle the issue of stereotypes. So that is their topic that they will be focusing on, and along the way, they have been creating a really great slogan, which I don't have on the top of my head, but I'll probably bring that back when I remember it. But a lot of it is because we're trying to give them a fun and an engaging way for doing things. So, and that's the reason why they keep coming back and they are our main recruiters. They recruit their friends to keep coming. So,
right.
Yeah.
What's interesting too about the teen programs is, with the leadership that's in place with the programs between Suchenda, yourself, also Linda Sue, Masada Jones, and so many of the staff members. It's fascinating because your leadership provides leadership throughout the community, not just with the health center programs.
Absolutely.
You really see yourselves as integrated into the fabric of the community, working with COOL, with the City of Lowell, working with, other agencies and nonprofits. I mean, you really want to know how you can be a resource. And I think that's a fabulous sort of message to send. And it also sends a message internally with the health center just how important it is to be an integral player and part of the community that we're all in.
Yeah, it speaks to the core mission of the health center to be a leader in the community, involve other community agencies, be partners with others with similar interests, and to promote, public health. That is the major goal. And involving youth as our future leaders and empowering them to lead future programs at the health center or even in the local area is, I think, a part of the mission too. And it can only help, promote the whole concept of public health. So it's very, very interesting.
It's fascinating. And so, Chenda, I would imagine with Dance for Peace, just so that our viewers know if they're interested in coming, when is it, what is it, how much, and what do the programs support?
All right.
Just a little plug.
So a quick plug is Dance for Peace is happening August 1st, 2012. The show starts from 6 to 8, and the cost of it is a little different this year. We have pre-sale tickets, which starts at $5 if you're under 18, $7 if you're an adult, and then the day of the event, if you want to purchase a ticket, it is $10 for adult and $7 for anyone who is 18 and under. The event is focusing on stereotypes, and the slogan is "Turn down the stereotypes, turn up the peace," and that is something that we're going to be tackling during that day, is the issue of stereotypes within the community. So
fabulous. So 5 years from now, what is Dance for Peace going to be accomplishing? More 10 scholarships?
Well, last year we were able to give 4. This year we aim to give 6 to 8. I mean, every year it gets bigger and better. The more money that we raise, the more scholarships we can give out to community, to youth in the community who are hoping to get a college education or need financial assistance in that way. I mean, we hope to, at one point, utilize the whole auditorium, 2,500 guests. So at this point, we already reached the maximum capacity for the downstairs level at 1,300. So we hope to do that again this year. So in 5 years, I can't imagine that Dance for Peace will be all around the country and not just in the city of Lowell.
Wow.
Giving the participants in this a space that they can call their own within our new building was an enormous help.
Yes.
And like I was telling you, I'm pretty jealous of the space that they have.
It's going to be the top notch.
It is going to be the focal point.
Yes.
And so, I mean, they actually have a studio with wall-to-wall mirrors that they can use for practice dancing.
Amazing.
There as well within the health center. So it is an amazing integration of what we have. So.
Well, and will the community be able to utilize that space? Will you be bringing in, UTAC and other hip-hop artists to come
we've
practice?
been able to collaborate with other youth organizations along the way. I mean, it's not just us who, we're the main people who do Dance for Peace, but we also integrate other youth agencies. So obviously the space itself is obviously accommodating for other young people who want to be a part of our program, and moving forward as far as like being a part of dancing and extra incentives that we do for activities and things like that. So of course it can be a little open for them too as well.
Excellent. So. Well, very exciting news. And if anybody wants to sponsor Dance for Peace, do they contact you?
They can contact me, but we do have a main number. Masada Jones is the lead coordinator, so you can actually call her as well. So the number is 978-337-4300.
Great. Yep. Well, I'm excited to hear a little bit more. Stay tuned for more of Spotlight on Community Giving with Lowell Community Health Center. We've got some incredible information about how to do a capital campaign, because these folks have been the experts. So if you're looking to think about that for your organization or for a nonprofit you might know, stay tuned for more information. Hello and welcome again to Spotlight on Community Giving. My name is LZ Nunn. I'm the Director of Development for the Greater Lowell Community Foundation, and want to welcome you back for our conversation with Lowell Community Health Center and Dr. Kumble Rajesh, who is the CMO, and he does pediatric medicine is his specialty, and Sochenda Uch, who's one of the coordinators of the teen programs at the health center. So welcome back, and we have sort of a hot topic in this this area of the segment, which is we really want to focus on something incredible that's been hitting our news a lot lately around your capital campaign.
Yes.
And my understanding is about 2 years ago you secured a significant amount, many millions of dollars in some federal and local funds for your building project and your renovation. And at a certain point you thought, okay, we're close enough to start closing a gap with a capital campaign.
Right.
So, and you had some innovative ideas around that. So I'm curious to know, in this challenging economy, at what point did you know this is the right time when the other interesting thing about a health center is you didn't have necessarily a donor base as
Correct.
a local museum might, so.
Oh, absolutely. I mean, we started with a really blank slate, and we didn't know anything about donors, campaigns. These are words we've never heard of. Coming in, taking care of patients, and trying to get them better was our thing. But this is an incredibly different opportunity for us. And we knew we had to close the gap of whatever our final costs might be to whatever grants we have received. And we initially picked a number of $5 million that we are raising the capital campaign monies for. Our team was caring for Lowell. There were a lot of skeptics saying exactly the same thing that you just said, in this lean times, economy being tough, and how are you going to raise the money, plus, people don't know who you are. People don't really understand that there's a health center that they can donate money towards. Our development director, Maura Smith, has done an incredible job of trying to put everything together for the capital campaign, and her theme was, you ask. Basically, it's just the ask that is the most important step in getting funds. We put our stories everywhere. We talked about the health center. We talked about the people we serve, and people were in awe of the number of patients we serve and the type of patients we serve and the cultural diversity we actually encounter on a day-to-day basis. So this was a situation that people felt that there was a need to give, and we now have over 1,200 donors for the campaign.
Incredible.
And interesting fact is, they're not all donors from Lowell. There are some donors as far as Boston. There's donors from Chicago. There are places from incredibly far away that believed in our mission. They believed in our stories that of care that we provide every day, and of the patients we see, of the opportunities we create within the community, of the reach that we have within the community. So these were things that really opened people's eyes and their wallets, of course, to help us get to where we are. So we are very, very proud to say we are about $3.5 million in our capital campaign towards the end target of $5 million, which we hope to achieve by the end of the year. It's an incredible achievement for somebody who started with no knowledge of donors and campaigns, and with a clear blank slate of whom to ask. And then we started this process, and we are here now with 3.5 million.
Wow.
One important aspect of this is the employee donations.
Yes.
The employees have been incredibly supportive. We have reached almost 100% of our employees giving to the campaign, and we have tallied almost $325,000 just from employees alone, with their pledges over 1 year, 2 years, 5 years, whatever the time duration might be. There's not one single employee who's not excited about this project, who doesn't want to participate.
And that's a game changer to your donors as well.
Absolutely, with 100% board participation, near 100% employee participation. That is in itself a selling point to donors, to say this is something that they would easily believe in to donate. And
absolutely. And I think what's unique about this capital campaign is you've really sort of fine-tuned. I mean, here's an organization that's never done, you've never done a capital campaign.
Ever.
You've never really gone out and asked the public and donors to support you.
Correct.
And you've figured out not only how to do it with, you know, with an incredible amount raised already, 3.5 million in just a year and a half.
Yes.
But you also are doing this through telling some probably very personalized stories.
Yes.
And so I'm curious,
Yes.
maybe for some of us who would like to know a little more,
Sure.
how, you know, I want to know that sort of heartfelt story. I want to know, and I know you
there are
can't share
so many.
names, but I think,
Yes.
you know, I know, having worked with
Yeah.
refugees and immigrants and people from many different cultures and communities, you know, that's what people are longing for.
Sure. I mean, like I said, there are so many compelling stories. You know, every day it's a revelation for us as to the struggles people go through, the endurance of people in their daily lives, and in trying to get the best health care for not only themselves, for their children, and trying to chart a course for their future. And that's what it's all about, you know, maintaining a healthy lifestyle and going towards a bright future. And the way they start off is incredibly challenging. I can share with you a couple of stories. You know, one of the stories that really touches me every day is at the Meta Health Center right now, that location. We cater to a lot of refugees who come into the country, who need their initial exams, who need to go through a certain set of rigid rules of testing and exams for their immigration purposes. So we go through, and whole families come through at one time. And these are some of the families that have just arrived in this country with nothing but their clothes on their back, literally. They have no resources. They have no place to go, no place to stay. The very first thing that we do is obviously care for them medically, but the other things is to provide them with resources for providing shelter, providing you know, a resource for their perhaps a way of income, or perhaps a way of you know, getting them settled in this location or elsewhere in this state. The employees at Meta Health Center came up with something really heartwarming. What they decided was to ask their own employees to donate used clothes and shoes and whatever household items that they have in there, and they put all of them in very little space that they had, and they called it their own Macy's. So when the refugees, they come through, they actually went through this place, and they were allowed to pick whatever they wanted. You know, from this, you know, shirts, coats, you know, shoes, toys, you know, things like that. And you know, one of the stories that I hear was this really young child who you know, picked up one of the very colorful T-shirts, and you know, couldn't take her eyes off of the T-shirt, and really kept holding it close to her all through the time that she was there, and wouldn't let go of it.
Wow.
And you know, these are stories that really touch you. In pediatrics and other places, we see this every day. You know, one of the other stories is of this 12-year-old who came in to see me, just clutching his abdomen with pain, clutching his belly with pain. You know, a little bit later, I found out that he had appendicitis and he had to be taken in for emergency surgery. Wow. But the story behind that is not the fact that he had appendicitis or he had the surgery, or he, you know, we were able to achieve that. But the fact of the matter is, his mother brought him to us 3 days after the symptoms started. She could not get him out of the house because she had other children to care for. There was nobody else in the house. She couldn't find anyone to babysit her children. So she allowed the symptoms to progress to a point where he could barely walk. He was doubled over in pain, and he walked all the way from his home to come in and see us at the health center.
Wow.
I mean, so these are stories behind the stories that we ask for.
Yes.
I mean, it was great that he had his appendicitis diagnosed and then he got his care that was necessary. But if you dig a little deeper, all these families have really troubled stories that you wish you could support. And we do that through community outreach, through talking to, you know, families, to get them understand the families a little bit better, not just their physical health, but their whole health, you know,
Yes.
around them, their financial, their home situation, or what have you. So these are things that we feel incredibly lucky to be able to serve.
It's a really powerful example of how moving and broad spread your influence is in the community. And really it's achieving that level of comfort so that mother and her children can come and get the care that they need. And I think the other piece you mentioned about employee giving, I know, Suchenda, you have an incredibly interesting story of your own, and I don't know how much you might want to share, but I know you have sort of made it your personal commitment to give to the health center as part of this giving campaign. Yep. But in part, I think probably through some very personal connections that you might have with the health center or with Lowell, and I'm sure that people would be kind of excited and fascinated to learn a little bit.
Yeah, I mean, so before I was here, my parents were here before me. They immigrated from Cambodia during the genocide, and so Lowell was their choice of place to be and to grow and to obviously raise us. All of myself and my brothers and sisters were all fortunate to be born here. And through this, my father was doing work in the community, giving back to the community, trying to work out, getting other members and families to come to Lowell and to kind of start a life here. So I saw him and grew up seeing it. But at the same time, I was struggling myself, going to a private school and things like that. I was transitioning out into high school, didn't make any friends. I didn't know I didn't have any friends then, so I started to, one of my friends from the Anglo dance troupe had told me to go to the Teen Coalition, which were part of the health center at that time as well. So that's how I kind of got connected with the health center and realized that my calling was that all the benefits and the things that they had supported me throughout my teen years, I want to give back. Eventually I moved on to college, but my career path led me back to the health center. Next year coming January will be 5 years of me working at the health center. Wow. So it's been that long, and the reason why I decided to give and try to push other people to give is because of that connection. I was given an opportunity. I was given many opportunities to do things and to be in a positive track, and I felt like the health center has given me that, and so I was just trying to give back in that way. But at the same time, it was an opportunity for me to do something great for myself and my family, to really give a name in the community. We get a brick on the wall, it will say my name or my family, Uch family or something like that, to leave some sort of legacy for my kids, to see that giving is a good thing when you know what you're giving is going to be something great, because of with this building there'll be more opportunities for other people to really get connected with the health care that they need, and for us to provide them with those services is an awesome and amazing feeling, especially when I know I had my part in it. So
wonderful. And so if people want to go to your website or help out in some way to support, where should we send them?
It's www.lchealth.org. So there's donor links on the web page that they can do. Great. There are phone numbers there to call us as well. We can do that as well.
Well, thank you so much for joining us today. Again, we really appreciate you all turning in for Spotlight on Community Giving. And if you would like to learn more about the programs offered through the Greater Lowell Community Health Center or through the Greater Lowell Community Foundation, do give me a call, LZ Nunn over at the Community Foundation at 978-970-1600, or you can look on our website and see what programs are coming up, www.glcfoundation.org. We have a great bike-a-thon coming up for local nonprofits and look forward to getting you involved. Thank you.